An onion can make your eyes water, transform the flavor of a meal, and provide several useful nutrients. But can it relax your blood vessels, improve circulation, lower blood pressure, or prevent dangerous blood clots? The honest answer is more interesting than either yes or no. Onions contain plant compounds that researchers are studying for cardiovascular effects. However, eating an onion does not open blocked arteries, thin your blood like medication, or provide immediate protection from a heart attack. Today, you'll learn what onions may realistically offer, which popular claims go beyond the evidence, and how to include them in a genuinely heart-healthy eating pattern. Welcome to Dr. Maxwell Orvane, where we make health information clear, practical, and medically responsible. Onions belong to the allium family, along with garlic, leeks, scallions, and chives. They provide small amounts of vitamin C, potassium, folate, and fiber. They also contain sulfur-containing compounds and flavonoids, including one called quercetin. Quercetin has attracted attention because laboratory research suggests that it can influence oxidative stress, inflammation, and processes involved in blood vessel function. The inner surface of a blood vessel is called the endothelium. Healthy endothelial cells help vessels respond appropriately when tissues need more blood. This has led to a popular claim that onions increase nitric oxide and rapidly widen the arteries. But there is an important difference between a biological mechanism observed in a laboratory and a meaningful clinical result from eating an ordinary serving of onions. Clinical trials have examined concentrated quercetin supplements and onion extracts. Some reviews suggest that quercetin supplementation may produce a modest reduction in blood pressure in certain groups. Results have not been completely consistent, and supplement doses cannot be translated directly into a specific number of onion slices. Whole onions vary in quercetin content according to their variety, growing conditions, storage, and preparation. Red and yellow onions often contain more flavonoids than white onions, but color alone does not turn an onion into cardiovascular treatment. What about blood clots? Platelets are blood cells that help stop bleeding after an injury. Laboratory and small human studies suggest that compounds in onions may influence platelet activity. That is scientifically interesting, but it does not prove that eating raw onion prevents deep vein thrombosis, stroke, or heart attack. A dangerous clot involves far more than whether platelets become slightly more or less active in an experiment. Risk can be affected by atherosclerosis, abnormal heart rhythm, surgery, prolonged immobility, cancer, pregnancy, smoking, inherited conditions, and many other factors. Most importantly, onions cannot replace aspirin, anticoagulants, cholesterol medication, blood pressure treatment, or any medication prescribed for cardiovascular disease. Do not change your medication because you started eating more onions. Claims that onions make thick blood flow normally or clear clogged arteries are also misleading. Blood is not usually too thick because someone failed to eat a particular vegetable, and fatigue, brain fog, or cold hands do not prove that the brain or limbs are being deprived of blood. These symptoms have many possible causes. If you repeatedly develop calf pain or cramping while walking that improves with rest, notice that one foot is colder than the other, or have a foot wound that heals poorly, arrange a medical assessment. These can be signs of peripheral artery disease, especially in people with diabetes or a history of smoking. Sudden chest pressure, shortness of breath, facial drooping, one-sided weakness, difficulty speaking, or a suddenly painful and swollen leg requires urgent medical attention. Do not try to treat these symptoms with food. Does the onion need to be raw? Raw and cooked onions can both be part of a nutritious diet. Cooking can change the amount and availability of certain compounds, and boiling may allow some water-soluble nutrients to move into the cooking liquid. But the claim that heat destroys nearly every cardiovascular benefit is unsupported. Cooking may make onions easier to tolerate and can encourage people to eat them with other healthy foods. Raw onions work well in salads and salsas. Cooked onions can add flavor to beans, vegetables, soups, omelets, and whole grain dishes without depending on excessive salt. Choose the form you enjoy and tolerate. A varied, sustainable diet matters more than chasing a theoretically perfect preparation method. The same caution applies to claims that chopped onions must rest for exactly 10 minutes, or that olive oil acts as a special delivery system for quercetin. Food preparation can influence plant compounds, but clinical evidence has not established a precise resting rule that people must follow to protect their hearts. There are also reasons why more onion is not always better. Onions contain fructans, a type of fermentable carbohydrate. People with irritable bowel syndrome or sensitivity to these carbohydrates may experience gas, bloating, discomfort, or changes in bowel habits. Raw onion can be particularly troublesome for some people. True onion allergy is uncommon but possible. Stop eating it and seek appropriate care if it causes hives, facial swelling, wheezing, or difficulty breathing. Ordinary culinary amounts differ from concentrated quercetin supplements. Supplements can deliver much higher doses and may interact with medications. If you take warfarin, another anticoagulant, antiplatelet medication, multiple blood pressure drugs, or cancer treatment, ask your clinician or pharmacist before using a quercetin supplement. Food should not be treated as a reason to alter medication. So what is the best way to use onions for heart health? Use them as one component of an overall pattern rich in different vegetables, fruits, whole grains, beans, nuts, fish, and other appropriate protein sources. Pair that eating pattern with regular movement, adequate sleep, avoidance of tobacco, and management of blood pressure, cholesterol, and blood sugar. Try adding a tolerable portion of onion to a bean salad, vegetable soup, whole grain bowl, or homemade salsa. The benefit comes not from a single dramatic reaction inside an artery, but from repeatedly choosing meals that support cardiovascular health over time. Here's the practical recap. Onions are nutritious and contain quercetin and sulfur compounds. Research suggests possible cardiovascular effects, but evidence does not show that onions clear arteries or prevent blood clots. Raw is not automatically superior to cooked. Supplements deserve more caution than ordinary food. And your complete lifestyle matters much more than any single vegetable. If onions agree with your digestive system, enjoy them as part of varied meals, not as medicine. Which do you prefer? Raw onions in a salad or cooked onions in a meal? Share your answer in the comments. If this evidence-based explanation helped you, like the video, subscribe to Dr. Maxwell Orvane, and share it with someone who has heard confusing claims about heart-healthy foods. This video provides general education and is not a diagnosis or a substitute for care from a qualified healthcare professional. Your medical conditions, medications, allergies, and nutritional needs may change what is appropriate for you.